The next section we'll be talking about for the language of suicide is asking the question. So sometimes saying the word is really hard. Sometimes just asking someone if they're suicidal, it can be very difficult to get yourself to do, but it's so important when talking to somebody about if they're suicidal. A myth that we run into a lot, or that happens often, is if I talk to somebody about suicide, it'll make them follow through with their suicidal thoughts. The fact is if you openly talk to someone about their suicidal thoughts, they'll actually feel more open to talk to you and actually less likely to follow through with it. When we're talking to somebody about suicide, we need to be open and willing to talk about how the person is feeling, which can also be kind of hard, but we need to be able to do this if we want to be able to help them work it out and work out their suicidal thoughts. We need to be able to focus on verbal, behavioral, and situational clues. We'll get to that in the next couple slides. The direct verbal clues that we definitely have to look for, and if we hear, it's the immediate red flags that we definitely have to start working on. So, for example, if you hear somebody say, "I'm going to kill myself," or "I've just decided that people would rather me not be here," or "I'm just going to end it all. It doesn't matter anymore," or something that we hear often is if this or that doesn't happen, I'm just going to kill myself. If I don't get into this college, then I'm going to kill myself. If I don't get a 4.0 or if I don't get these types of grades, I'm just going to kill myself. These are the direct verbal clues that we have to look for when talking to people, of being able to know that immediate red flag. The indirect verbal clues that we also need to look for are things that are more subtle, sometimes can come across as a joking way, but still just as important. Some of these indirect verbal clues could be such as, "I wish I could go to sleep and not wake up." This is a common statement that people will make at times, where they don't think to themselves that they might be suicidal, but that it would just be nice to be able to sleep and just never wake up, never have to worry about any problems. However, this is still a suicidal statement, just more of a subtle way. Something that happens is, "People would be happy if I wasn't around anymore." There's a lot of, sometimes people will think, especially about their family, my family would just be happier if I wasn't around. I wouldn't be such a burden to them. Things like this, things like that. Or things like, all I do is cause problems. These two, the people who would be happy if I wasn't around and all I do is cause problems, these are sometimes kind of joint statements that people will make, that make people think like it would just be better if I just wasn't here. Again, not so much of thinking to themselves that they might be suicidal. However, this is a suicidal statement. One that is said as well is, you won't have to worry about me much longer," kind of indicating that, in an indeterminate amount of time, I won't be here, so you won't have to worry about me anymore. Again, definitely a suicidal statement and a red flag you have to pay attention to. There will also be behavioral clues. Behavioral clues are things that have happened in the past that this person has done that indicate their risk being increased. Some of these clues may be such as previous suicide attempt. If somebody has attempted suicide before in the past, their chances of suicide goes up. Especially within the last 3 months, the chances of suicide is higher. And also throughout their lifetime, it does as well. If someone has attempted before, sometimes that it'll indicate that they could do it again. Sometimes drastic mood swings. The way that we see this is somebody could be very happy in one moment, or all of a sudden very angry, and they do this constantly. Or they will be just fine and then burst into tears. These are the drastic mood swings that we're looking for, where it just seems like they just come out of nowhere. Change in routine. This is definitely a big one, and sometimes it's easy to find, because especially if we know the person well. For example, one thing that happens often in the school setting that we see is we'll see somebody who first and second quarter are just doing great with grades. They get all pretty much A's and B's. And then we get into third and fourth quarter, and all of a sudden they're getting C's, D's, and F's. Usually this kind of means to us that something is not right. This is a change in their routine. It's not something that they usually do. Something else is they won't spend as much time with their friends. They'll like to say, I'd rather just stay home. I'd rather just be in my room. These are the changes in behaviors that we have to start paying attention to. Next one, isolation. When we talk about isolation, it just means they just don't want to be around other people anymore. They just stay clear of other people. Risky destructive behavior. With this, sometimes people just act as like they don't care anymore. They'll do things like they'll speed constantly in their car. They will use drugs or alcohol when it didn't used to be what they used to do in the past. Just more risky behavior that you should pay attention to. Giving away possessions is another behavioral clue that happens often with people that we recognize. They start to give away possessions that mean a lot to them, but they just don't seem to care about anymore. Again, this usually indicates that something is not going right in their life, and it's something that we have to be able to pay attention to and be able to figure out why they're doing this. Next one takes us to situational clues. Situational clues are things that pretty much happen in all of our lives but are very difficult for us all to deal with. For example, losing a job can be very difficult. If someone loses a job, they may think to themselves as though they've lost worth or things like that, which may indicate that they may be starting to have more suicidal thoughts. Such things as getting suspended or expelled, divorce in the family. This one is actually a common one that we see in the school setting as well. If a student and if students' parents are either having a difficult marriage, or they're separating, or they're divorcing, this will make them start to have a little bit more suicidal thoughts or just more difficulties with their mental health. It's important to recognize when people start to have difficulties like divorce in the family, that something may be more difficult for them. The mental health is becoming more difficult for them and might start be thinking more about suicidal thoughts. Another one is breakup from a partner. This happens often in school settings as well. We have to recognize many students, when they're in a relationship, it's kind of all consuming to them. And so when it ends, it's hard for them to recognize life without that person. And so we can know that this can be something very difficult for many students. Death in the family, or recent diagnosis or health problem. Sometimes there's people in general, when they find out about a health problem, they start to lose a lot of hope, because they get overwhelmed with so much of what's going on and what they're going to have to do with that health problem or that mental health diagnosis. The thing that we want to focus on when we talk to people is we want to set the scene. We want to set a good scene for us to be able to comfortably talk to a student, or the person who is in need of support. A couple things that we would like to do to try to help that is, when you're trying to talk to somebody, try to pull them away from other people. Try to get them into a private, get them away in private. Doesn't mean you have to be in your own office or anything like that. It can be just away from a crowd. The reason why we do this is because it helps that person feel a little bit more confident to be able to talk to just one person, rather than be overwhelmed with multiple people, or even feel embarrassed that they're talking about this with other people around. So if we can pull them away from other people, this can be a good step in getting someone to be open and talking about what's going on. The second one there is be persistent. So when talking to an individual that may be hesitant to tell someone that they are suicidal, we want you to be persistent. We don't want you to be overbearing, but we want you to be persistent. Multiple times, very common thing that happens to me as a social worker is, when I pull a student in, I'll ask them, "How are you doing?" And they'll just immediately say, "I'm doing great." And then so I'll let them kind of go along with that for a minute, but I'll say to them, are you sure that you're doing okay? And I'll be persistent with them and really trying to figure out, are you really doing okay? Generally, that student or that person will tell me that they're not doing okay if they are not doing okay. They will let me know that, whatever such and such things are frustrating to them. But we have to be persistent. And again, I say be persistent, not overbearing. We don't want to keep badgering them until they finally say, yeah, I'm going to hurt myself, or such and so this and this thing is going wrong. But being persistent to let them know, I know you feel like things are okay, but there's likely something that's probably not going well in your life. And that's okay. And you can still talk about that. And we want you to talk about that. But being persistent is important. I think too often we kind of get the answer that we might be looking for, and we just let that person go. And at times I feel like that can be more damaging to that person than it can be good, because they think maybe they can't be open with you at that time. When we set the scene, we have to be able to let the person talk. We just need to let them talk. A lot of times we are so consumed in talking ourselves that we don't let the other person talk. When dealing with a suicidal individual, we have to let them talk. If we are able to let them just talk about what's going on, they're going to feel better in general. They're likely just going to feel better because they're able to just get things off their chest that they have not been able to get off their chest before. The last one here is allow the person time to talk. Sometimes I feel we get kind of in a rush, like we're trying to get to a meeting, and we try to pull somebody in real quickly, and we say, hey, are you doing okay, or something like that, and we kind of end up pushing them almost out of the door because we're so concerned about the time that we have. And obviously time is an important issue that we all have to deal with. However, when dealing with a suicidal person or someone who needs to really talk, we have to allow them that time to talk. We have to remember this is a life or death situation, and they need to be able to feel comfortable to be able to talk and not be rushed. However, we don't want them to talk hours and hours and hours, but we can at least guide them in a direction to know what we can do to help them, but giving them a moment to be able to talk about what is going on with them. There's different ways that we can ask people. In the first section here, we're going to talk about direct ways of asking. So this is when we feel like we have to directly get to the point. Usually I feel like these are probably at the point where we spend some time trying to see what's going on with the person, but we feel like we aren't really getting anywhere. We need to be a little bit more direct with that person. So it's important to remember that we also need to be soft, but again, we need to be direct. Saying such things as, I have noticed you've been down lately. Have you been having thoughts of suicide? Again, actually saying the word suicide, it's very difficult at times for people to use it, but extremely important and effective when we use it. It's important that we use validating language when we say it. I'm aware that lots of people have had suicidal thoughts. Are you having suicidal feelings? Emphasizing that lots of people have the same thoughts. This is validating to somebody, recognizing that you are not the only person that has this. Multiple people have these. Almost everybody in the world has probably had a suicidal thought, and that's okay. We can have that. We can have it as a person. We can have feelings and thoughts, and we can all help each other with that. And to know that this person's not alone, that they can reach out to other people. Another thing that we can say is, I have noticed you've been alone more often. Have you been having thoughts of hurting yourself? Again, being straightforward with that person. Recognizing and pointing out the action that you've seen. They've been alone more often. More often than you have noticed in the past. And so again, have you been having thoughts of hurting yourself? After trying softer language, but you haven't really been able to get that person outright say anything, Just go straight to the point. Are you having thoughts of suicide? Are you suicidal? Have you had thoughts of hurting yourself? Going straight to the point and trying to see what is it that you can do, what is going on with that person that you can help them with. The indirect ways of asking somebody is when you feel like you can try to help that person open up a little bit more. Again, using that soft language that's also comfortable. I've noticed you've been sitting by yourself more often. Are you feeling okay? Are you okay? I've been concerned about you failing classes. Is there anything that you would like to talk about right now? Is there anything going on that would, show that this is maybe why this is happening? Another indirect way is to begin with focusing on how much you care about that person. So being able to just genuinely say this to them: I care about you a lot. You are an important person to me. Is there anything that you're going through that I can help you with? Again, starting out with something that is very validating to that person and then showing that you care. I care about you. I hope that you're okay. Statements that we want to avoid when talking to a suicidal individual is we don't want to use any negative or leading statements. I think sometimes, in my own opinion, I feel like sometimes we kind of we use some of these statements because we are concerned that they might, but we are hoping that we can lead them away with a statement like this. A common one that is said that I've seen is, you're not going to kill yourself, are you? Again, you're kind of leading them, and it's also kind of negative as well. You're leading them to say, no, I'm not going to hurt myself. And you're not really giving them a chance to be able to be open with you. And again, it's kind of negative. You're just saying, it's almost like you're kind of saying like an almost in a condescending way, like you wouldn't ever allow yourself to do that. One that happens commonly too is, I know you aren't going to kill yourself. It's like you're almost kind of taking the power away from them. And just saying like, I know who you are, you're not going to do this. Again, it's leading. It's a negative statement. One that happens often too, and this one is can feel as though it's condescending, is you have so much going for yourself. For example, you're so smart, or you're such a good athlete. Why would you ever consider killing yourself? Or you have a great vacation coming up, or you have kids. Why would you ever consider killing yourself? Again, it takes a lot of power out of that person. And it leads them to think almost negatively about themselves. Why would they think that way? And again, thoughts are thoughts. We feel this way because it's probably something's just not going right in our life. And if we lead a person down that road, it can be very hurtful to be able to be told that. Sometimes we try to lead the person or kind of minimize their problems. We might say things like, just try to be happy. That should help you not be suicidal. Like, just don't have depression anymore. Again, extremely hurtful because people don't know why they sometimes feel the way they do. They just do. And they don't understand that. And they're trying to figure it out themselves. And if they could be happy, they probably would just be happy. And so we have to be able to recognize that we can't say hurtful words, hurtful things like that, because this person is probably working very hard to not feel that way at that point. So these are the statements you really need to try to avoid when talking to a person. Really try to think through what you're saying to this person and ask yourself, is this going to be supportive of this person? Is this going to show the person that I really care? So chances are, if you use these statements to avoid these negative or leading statements, they're probably not going to talk to you anymore about this. They're going to feel like they're going to be judged or feel like they're a bad person in a way. And they probably just won't say anything to you anymore about it, which will really ruin your chance of helping that person in the future. That concludes this section, and we will continue talking about this.